You already know that chelidonium is good for fatty liver and gallstones. The action on the liver is very strongly marked in the provings of chelidonium. These liver troubles range from hepatitis, fatty liver, gallstones, hepatic and gallbladder obstruction, stones, etc. But do you know at which stage of the disease you should give this remedy? What symptoms indicate this remedy at that particular stage? There is a practice trending now to give chelidonium to every patient diagnosed with fatty liver. The remedy gives the best results when prescribed according to the law of similars. For that, you must first know the main indications of chelidonium. To make it easier for you to understand and remember, I have organized the indications of chelidonium into 4 main categories. One is the pain. There will be a fixed pain under the lower inner angle of the right scapula. Now, pain in the hypochondrium will also have a referred pain in the right shoulder. With the pain in the right hypochondrium, there will also be tenderness. The second is the jaundice. The tongue is coated thickly yellow with red margins showing imprint of teeth. There is yellowness of the conjunctiva, face, hands and skin. The stools are grey, clay colored or yellow. Urine is also yellow. Next are the GI symptoms you will find in chelidonium patients. There is bitter taste in the mouth, bad odor from the mouth, loss of appetite, nausea, vomiting. The patient prefers hot food and drink. Even the nausea and vomiting are better from very hot water. Also, eating will temporarily relieve the complaints of the patient. All complaints will lessen after dinner. The patient also suffer from alternation of diarrhea and constipation. If it is constipation, the stools are hard, round balls like sheep's dung. And if it is diarrhea, there will be yellow, pasty, clay-colored stools that flow out in water. Now, there are some concomitants you have to remember. The patient is very lethargic. They don't like to make any effort to move. They don't like to move. There is drowsiness after eating and waking. They like to lie down to meal. There is sleepiness. There is yawning. Another concomitant is vertigo with inclination to fall forward. Another concomitant is right foot is cold as ice, the left is natural. All these symptoms may be found in either an acute or a chronic case. If in a chronic case, some antisorics like lycopodium may have to be called after chelidonium. If you want to update your knowledge on homeopathic therapeutics, you should consider subscribing to this channel. Now, let's examine specifically about the pathological indications, that is in fatty liver and in gallstones. Fatty liver disease means that you have fat inside your liver that can over time affect liver function and cause liver injury. Fatty liver disease is sometimes called a silent liver disease. This is because fatty liver can happen without causing any symptoms. Most people with non-alcoholic fatty liver disease live with fat in their liver without developing liver damage. A few people who have fat in their liver develop NASH, that is non-alcoholic steatohepatitis. Symptoms from NASH are tiredness, weakness, weight loss, yellowing of the skin or eyes, spiral-like blood vessels on the skin and long-lasting itching. So now you can see that when a person proceeds into the stage of steatohepatitis, you need chelidonium. Sometimes patient with fatty liver may develop some signs and symptoms. Even in that stage also you can give chelidonium. You can give chelidonium for gallstones. Gallstones can cause bile duct obstruction. If your bile duct is blocked, it cannot transport bile or pancreatic juice to your intestines for digestion. This causes bile to build up in your liver and increases bilirubin levels in your blood. Now the symptoms of bile duct obstruction are pruritus or itchy skin. There will be pain in the right upper abdomen, fever, nausea and vomiting, tiredness and fatigue, weight loss, loss of appetite. Here again you find the features of chelidonium. If you found this video useful, share it with your friends. You can also follow me on Instagram to know more clinical tips and case studies.